Okay, hello, thank you. I'm Dr. Kirtita Acharya. I'm a consultant endocrinologist and diabetes specialist working at SHA Hospital. I'm also the president of Diabetes Kenya.
How is important is it raising diabetes among the young people?
It's very important because diabetes can affect young people. Most of them get type 1 diabetes, which is insulin dependent. The pancreas is destroyed by autoimmunity. So the pancreas is destroyed and they need insulin for the rest of their lives. But if it's well controlled, they live a normal, healthy life. However, nowadays we are seeing more and more young people getting type 2 diabetes, which is a lifestyle condition because of obesity and unhealthy lifestyles. Some young people also get maturity onset diabetes of the young. It's rare, but it happens. It's a genetic condition where they may need insulin initially and then later on they can progress to tablets. It's very important that a doctor picks this up so that they're not treated wrongly. Young girls get polycystic ovarian syndrome, a hormonal condition which can then progress to diabetes, and other hormone conditions, hormonal imbalances can also cause diabetes in young people. So there are a whole plethora of different types of diabetes that can affect the young people.
The world marks World Diabetes Day every year.
Yes.
What's your theme this year and what do you hope to
Sure.
achieve?
So the theme this year worldwide and in Kenya we're celebrating the same is wellness or well-being in the workplace. Now, wellness or well-being is very wide. So it encompasses physical health, so like sugar, blood pressure, cholesterol, heart health, brain health, physical well-being, your weight, the ideal weight for a person, but also there are things we can't measure but they're equally important and that impact on your health and the outcomes, prevention of complications. So things like mental health, we don't want people to get anxiety, depression, sleep issues, insomnia. Things like emotional health. People are sad these days, and that also impacts on whether they take their medication or not, whether they go see their doctor or not. Young people tend to get a lot of these, the blues, depression, and because as a result of this, they're not compliant or adherent with their medication, and then they succumb to vices like taking alcohol, smoking, drugs. So it's very important that we keep them away from this by guiding them as adults. And then psychological well-being and also financial well-being. For somebody to have a chronic condition, they need to be able to afford their medication. They need to afford the tests, the monitoring. Diabetes is an expensive disease. Not all patients are insured. Not all insurances cover diabetes. So as advocates, like for example, as president or national chair of Diabetes Kenya, myself with the rest of the strategic partners working, the government, the Ministry of Health, we have to make sure that there's equity of healthcare so that anybody living in any county in Kenya, whether they're in the slums, wherever they're living, they can afford the medication, they can afford the monitoring equipment, they can afford to see a specialist who can give them the best treatment possible. There's work to be done, but we have still achieved a lot, I think, in the last decade or 2 decades in diabetes care in the country.
What are your plans to ensure that you maintain long-term awareness beyond just this one day?
Oh, of course, World Diabetes Day cannot just be one day. I believe it should be every day. There has to be personal responsibility, so everybody out there should empower themselves. They should know their sugar status. Blood pressure is another big, dragon out there. It's not just a disease of the rich or the old, so everybody should go and get their blood pressure checked, their sugar checked. You should have the ideal weight, live a healthy lifestyle. But we need to do empowerment programs. We need to educate. Responsible media plays a big role, so it's very important to get the right messages out there, and with the right lifestyle screening. If you have a family history of diabetes, if a pregnant woman has given birth to a child that's either too heavy or too light, that woman can get type 2 diabetes later on. So knowing who is at risk, it's very important that this person gets the right follow-up and gets the right medication. There are a lot of myths circulating on social media about cures that don't exist. People get conned as well. There are lots of myths, and irresponsible messages out there. So Kenyans need to be told what are facts and what is fiction so that they can make